In Salford, we have quite a lot of patients that come into A&E who have problems with alcohol and exhibit quite chaotic behaviour when they come in. And we started doing a project which looked at the most frequent attenders who display really acute behaviour, who we ranked in a database based on their admission information. And the top 20 of those patients we started to look at and work with along with some partners in the community. And we noticed as part of that work that there was a group that sat below them in the database figures, which were a group of patients who were starting to exhibit that chaotic behaviour but hadn't quite risen through the ranks yet. And we had decided we'd take a look at them and see what we could do for that group of patients to help them to get their life back on track and stabilise and access services in the community before their life got so chaotic and out of control.
We'll all sit round together around a table. We'll have a look when they've come in, how many times they've come in, whether they've been seen by myself, whether they've been seen by the A&E staff, whether they've had any mental health issues, whether they've been seen by the mental health team. Even things like we look in our local advertiser to see if any of them are up before the board. You know, if they've not been coming in, why have they not been coming in? Are they, you know, are they in prison or on probation? It's looking at the bigger picture of a patient's case study, really. One of the examples that I can think of is a young lady that we backtracked over a couple of years, and we identified that every February she was coming into the department, usually up to 2 or 3 times a day. She was eventually referred into the alcohol specialist nurse service, and we had time to sit with her, and we identified that she had grief issues surrounding the death of her mother. And she'd never dealt with these properly in the first place, and therefore she was using alcohol. She was basically self-medicating with her alcohol to numb the pain. So what we did was we did a few sessions of work with her and referred her on to some brief counselling.
The benefits it brings to the NHS is it reduces attendances to A&E, it reduces unplanned admissions, bed days. So there's a big cost saving for the hospital and the PCT. This project is innovative because it puts the medical model on its head, as it were. In the past, we've dealt with patients that have come in using the medical model, so they'd come in, they'd see and treat them and send them back out again, because it's difficult to have the time to do anything more with these patients. And this is an innovative way of dealing with those patients, in that we give them the opportunity to say what help they need rather than us telling them what we can give them.